Hi, I'm Jason Bellamy, coming to you from Portland, Oregon, and National Student Conclave 2017. And basically, we just kicked this off with the opening ceremonies and also the Ignite Talk. So, Keaton Ray, you did an Ignite Talk. I did an Ignite Talk, 3 other people did an Ignite Talk, and what the heck's an Ignite Talk? It's 5 minutes, it's 20 slides, automatically advancing 15 seconds, and I want to talk to you about the themes of yours because I think it's great. First of all, you have a long history with NSC, you're on the Student Assembly Board of Directors, you've been involved, but the theme of your talk was really about sort of finding your passion, and it starts with basically admitting that when you were going through PT school, you didn't know what that was. Take me back to that time.
Sure, yeah. So when I was, actually it goes way back to athletic training school, when most people were assigned soccer or football, I was assigned clinic director, and I loved it. And I thought, okay, interesting, maybe that's a unique skill set for me. Then I got into PT school, and everybody was about pediatrics or neuro or sports, and I just wasn't ignited. I wasn't excited by any of those things. Until at a conference, National Student Conclave 2011 in DC, I think it's in DC. Fact check me on that, Jason, okay?
Check.
I met a member of the Student Assembly Board who convinced me to run for a position, and I just decided, you know what, nothing else is really getting me all that excited. I've tried to be a PT for so long, and I really need to find something that excites me. So I said, heck, why not? Let's run for a position, and so I was elected and served on the board for the next couple years.
So yeah, and so that's, I mean, it's so interesting because, you know, PT school's hard enough, right? Just the classes themselves, all that you're learning, all that you're doing, and to go through that when you're not even sure, like, what your place is. Yeah. I mean, how long did you feel that way?
Man, I mean, I felt like that. I still feel like that, honestly, Jason. Some people look at the Student Assembly Board and they say, you know, I don't have time for that, or I'm too busy taking tests, or, you know, every excuse in the book. But for me, being busy in something that I was really passionate about, in leadership and advocacy and talking to students and getting students involved, that made my clinical and my schoolwork so much easier because I was excited about something. You know, so if I didn't have that outlet to really express my passions, I would have been stuck with my head in the books, uninspired. Not that school is uninspiring. I mean, Duke, big shout out to Duke. They were so supportive in all of my efforts. But just for me, the clinical care wasn't where I got my passion from.
Yeah, and that's what's interesting. You know, this isn't a commercial for Student Assembly Board of Directors, right? Your passion happened to be this thing, but for somebody else it's going to be, but the main thing was you were looking for patient care to be it, and it wasn't. So how have you taken that student experience and brought it into your early career now? How do you apply that to actually being a real PT in the real world?
Well, despite my feelings during school for my clinical courses, I really wanted to focus the first 3 to 5 years of my career really strengthening my clinical skills with patients so that I had something to base the future leadership skills off of. So I've spent the last 3-4 years really developing my orthopedic skills. So I've had my CSCS, my OCS, and my McKinsey certification. But on the side, I've also been serving as a delegate for Oregon in the House of Delegates. I'm chair of communications for PT Day of Service, and I'm working with my good friends Josh D'Angelo and Afosa Guabadia on a couple of side entrepreneurial projects that we'll be telling you more about down the road.
And Afosa was the one that basically gave you advice that led to the title of your tonight's speech, and let's talk about that real quick, because it's basically the guide that you use to decide what you're going to get yourself into and put your heart into and what you're not going to, and tell me about that.
Yeah, so the title of my speech is if it's not a hell yes, then it's a hell no. And at first, I don't think that necessarily always applies. You know, if you're not saying hell yes to your neuroanatomy exam, should you say hell no? I said that in my speech. No, that's not the case, right? So for me, it's thinking long term. What are my long-term goals and my long-term visions? And if every single step along the way isn't getting me closer to that hell yes long-term vision, then I should probably say no to it. So obviously graduating PT school and doing well academically is getting me closer to my long-term hell yes vision. But there's a lot of opportunities that came along the way that I said no to, and I'm very thankful I did because it got me one step closer to my hell yes.
So, you know, this is the kind of knowledge you get not only from listening to Ignite Talks like Keaton's at NSC, but also through the experience. And it was basically at NSC where you had that first meeting that started you down this road. You can see more updates like this from NSC on the NSC website. She's Keaton Ray. I'm Jason Bellamy, and I'll catch you later.